Welcome to today's webinar, AI Imaging Solutions for the Early, Efficient Detection of Lung Disease. Lung disease, lung cancer in particular, is by far the leading cause of cancer death among both men and women, making up almost 25% of all cancer deaths. Each year, more people die of lung cancer than of colon, breast, and prostate cancers combined. Over 50% of all lung cancers are not diagnosed until later stages, with a survival rate of only 3.9%. However, with early detection, that survival rate jumps to over 50%. Early detection is key. With a mission to save lives through the early detection, diagnosis, and management of lung disease, Riverain Technologies has developed the ClearRead AI applications. Based in Dayton, Ohio, Riverain is a software developer building AI applications with a thoracic focus aimed at the early detection of lung disease, with FDA-approved products ClearRead CT and ClearRead X-ray. The common design element for all ClearRead applications is to assist both radiologist and machine by simplifying the image. We do this by removing the distractions. In the case of ClearRead CT, this means suppressing the vascular structure, and with ClearRead X-ray, suppressing the bone. This allows for an unobscured view at the lung field, providing increased efficiency and accuracy pertaining to nodule search, measurement, and characterization. Traditionally, computer-aided detection applications have been trained using real data. The challenge is difficult problems require large models, and large models need a lot of statistically significant data, with examples of all disease types. One problem with training on real data is that it creates gaps in unrepresented rare disease and bias in overrepresented more common disease. Also, since the applications must be validated against real data, when using real data to train, you must set aside a small percentage of that data to train against. This is inherently error-prone. At Riverain, we chose to use simulated data to train the ClearRead applications. Here are just a few examples of simulated nodules used in CT. In the context of training AI, there are many motivating factors. In using simulation, we can digitally replicate a wide range of disease types by utilizing existing clinical knowledge. This allows for the creation of large amounts of statistically significant data, which removes the potential for gaps and bias that exist with real data collection. Another benefit to using simulation to build a model is that all of your actual cases can be used for validation, unlike the small chosen set used to validate in the case of training with real data. The goal is to capture the spectrum of disease to ensure a broad statistical coverage. Another benefit of using simulation is the ability to focus on difficult cases. Not only are we able to simulate a wide variety of disease, we can also build training models by placing simulated nodules in different anatomical locations. In this example, we can take an otherwise normal chest X-ray as seen on the left, and through simulation, insert a nodule in the apices as seen on the right, which is a notoriously difficult area where nodules can be missed due to overlapping bone. Since we are not restricted to using limited real data examples, we can train ClearRead thousands of times on these digitally simulated models, which is essential in achieving accurate and repeatable results. ClearRead CT is the first FDA-cleared system for concurrent reading. This concurrent reading protocol is important from a reading efficiency standpoint. Up until the approval of ClearRead, all computer-aided detection devices use sequential read. With a sequential read protocol, the radiologist is required, per FDA label, to read the original exam first and then essentially read the exam a second time to utilize the CAD content. With our approved concurrent reading protocol, the radiologist is able to view the ClearRead content at the same time as the primary read, effectively eliminating the need for a second read, as is necessary when using a sequential reading protocol. ClearRead CT is also the first FDA-cleared system for all nodule types, including solid, part solid, and ground glass. As a vendor-neutral solution, Clear-read CT can be used with any manufacturer's CT system or pack, so no additional hardware is necessary. Through our large-scale, multi-reader, multi-case study, which was pivotal to our FDA approval, we demonstrated a 26% reduction in reading time as well as a 29% reduction in missed nodules. Clear-read CT also supports non-contrast and contrast CT studies. Clear-read CT is comprised of 3 applications. Clear-read CT vessel suppress, which is designed to remove structured noise, allowing for the unobscured view of abnormalities such as pulmonary nodules. Clear-read CT detect, which provides automatic nodule detection and characterization. And Clear-read CT compare, which allows for the comparison of a current study with a prior, enabling the ability to identify and track nodule change over time. Clear-read CT vessel suppress is a patented process for the suppression of vascular structure in the context of an axial CT exam utilizing simulated data. Clear-read suppress works for all nodule types, enabling a clear visualization of nodules by removing the structured noise. In this example, we see a typical CT slice on the left, and on the right, the corresponding slice with vessel suppression applied. This is an actual case used in our reader study, which was part of our FDA approval. This solid nodule finding was read as a false negative by the radiologist in the study. It's easy to see in the original image how this nodule could be missed. Nodules in the central lung are inherently difficult to detect, especially when they are roughly the same shape and caliber as the surrounding vessels. However, with vessel suppress applied, it becomes very apparent since the nodule is separated from the surrounding vascular structure. This makes the job of detection and characterization considerably more efficient and accurate for both the radiologist and the machine. Here is an example of clear-read vessel suppress showing a part solid nodule finding. Given the fact that there is a high reader disagreement when it comes to typing part solid nodules, it's important that both the solid and ground glass component of a part solid nodule are clearly delineated. While this particular nodule is quite apparent on the original CT image, suppressing the vascular structure around the nodule provides a much better opportunity to not only type the nodule, but to also accurately measure both the entire nodule and the solid component. In this case, we see an example of a ground glass nodule. Ground glass, in particular, can be difficult to detect and segment due to its low absorption. By using simulation to train the vessel suppress application, we are able to remove the entangled vascular structure from the original image and provide an unobstructed view of the nodule as seen in the vessel suppressed image on the right, making characterization much easier. Without simulation, it's highly unlikely that something like vessel suppression could be built. Vessel suppression goes beyond MIPS and min-IPs, which are conventional secondary volumes used for various purposes such as nodule enhancement. While MIPS have proven useful for solid nodules, they can also lead to false negatives due to their tendency to mask and change nodule characteristics, which can make detection and accurate measurement difficult. This is especially true in the hilar region, as in the example seen here. In the original image, the nodule looks much like the surrounding vessels with the same shape and caliber. With min-IPs, the nodule disappears altogether, and in the MIP projection, it's no more apparent that it is a nodule versus a vessel. In the vessel suppressed image on the bottom right, with the normal structure removed, the nodule is quite apparent. In this case, which was represented in our reader study and read as a false negative, we see a great example of the shortcomings of MIPS. In the original image, on the upper left, defining the borders of the nodule and separating it from surrounding normal structure is difficult. When MIPS is applied, as seen in the upper right, the problem is exacerbated and the nodule is further camouflaged. But once again, with vessel suppression and the ability to remove the structured noise, the borders of the nodule are easily discerned. Clear-read CT Detect builds on vessel suppression. This is the step where we provide automatic nodule detection and segmentation. The nodule is segmented in 3 dimensions, providing volume measurements, as well as linear measurements in the axial plane, the location of the nodule within the exam, as well as the type of nodule, solid, part solid, or ground glass. In the case of a part solid nodule, as shown here, ClearRead CT Detect will provide measurements of not only the entire nodule, but the part solid component as well. These measurements are displayed in detail on a summary report page. With the ClearRead CT Compare application, we can detect a nodule in the current exam and then associate that nodule with a corresponding location in a prior exam. By capturing two time instances of the same nodule, we can then determine if the nodule is growing, how much the volume is changing, and offer estimates of volume doubling time. A full ClearRead CT Detect summary report is provided. This report includes location, measurements, comparisons when available, and an image chip view for each finding. Measurements and other study-specific information provided as part of the ClearRead CT Detect summary report can be incorporated in a customizable template for migration to Nuance's PowerScribe reporting system. Options for ClearRead CT workflow include a CT device dual send, where the original chest CT study is sent to both the ClearRead server and the PACS system at the same time. An alternate workflow would be to send the original CT series directly to PACS first and then route it to the ClearRead CT server. In either case, once the ClearRead applications are applied, the ClearRead content is sent back to the PACS and inserted in the appropriate patient folder. From there, the original CT chest study along with the ClearRead content series are sent to the radiologist workstation for review. ClearRead X-ray is the first FDA-approved software application proven to increase reader detection accuracy as well as efficiency, utilizing bone suppression and image enhancement technology. The X-ray applications offer a scalable solution that can be deployed on a single modality or enterprise-wide. As a vendor-neutral solution, ClearRead X-ray can be used with any manufacturer's PACS system or X-ray device. Provided as an additional image, the ClearRead X-ray content can be easily reviewed alongside the original image for a quick and easy comparison. One application within the ClearRead X-ray suite of products is ClearRead X-ray Bone Suppress. By building a pixel-by-pixel map of the image and estimating the density at the pixel level within each area of the lung, we are able to suppress the bone, providing an unobstructed soft tissue image of the lungs. With a considerable percentage of the lung field occluded by bone, the ability of ClearRead X-ray to effectively remove it increases accuracy and efficiency in the detection of lung disease. In addition to suppressing the bone, the ClearRead X-ray application is also able to maintain consistency between the original image and the bone-suppressed image. When creating the bone-suppressed image, the detail and tone from the original image is maintained, facilitating an efficient and effective comparison. Another application within the ClearRead X-ray suite of products is ClearRead X-ray Enhance. ClearRead Enhance highlights lines and tubes on chest X-rays while maintaining excellent image quality. Since diagnostic quality is preserved, radiologists can minimize imaging adjustment and decrease reading time. ClearRead Enhance is shown to reduce reading time by approximately 19% without compromising accuracy or confidence. ClearRead X-ray Enhance doesn't just improve the contrast of the image, but first normalizes the image prior to enhancement. This example shows chest X-rays on the same patient captured with different devices. Even though the original images have different detail and contrast, the enhanced images have a similar look. This enables a consistent presentation across different manufacturers and removes the need for additional window and leveling. The ClearRead applications provide content as an additional series viewable alongside the original exam in a way that does not disrupt a radiologist's normal workflow. There are no additional applications to open to use the ClearRead content. Next, we will review a couple of demonstration cases showing the radiologist's typical workflow utilizing ClearRead CT and ClearRead X-ray. Here we have an example of a typical CT chest exam with the original study series loaded on the left, the corresponding vessel suppressed series in the center, and the ClearRead Detect series on the right. All series are synchronized so the radiologist can scroll on the Detect Index series, which includes any nodule findings automatically detected by the application. The original exam series along with the vessel suppressed series will automatically jump to the corresponding centroid slice where the detection is found. In this particular exam, there are 3 detect findings. The first finding is a small solid nodule found in the right lower lobe as shown here, visible in vessel suppression as well as in the original study. The second finding, also a solid nodule in the right lower lobe, again visible in vessel suppression and the native study. The final finding is a part solid nodule, highly visible in vessel suppression due to the subtraction of the surrounding structure, and again seen in the native study. By scrolling through the detect series, the radiologist can quickly move through each detect finding, jumping to the corresponding location on the primary study automatically. The radiologist can then continue reading the entire case by scrolling on the native study while maintaining the benefit of the synchronized vessel suppress and detect series content for review if necessary. Here is an example of a ClearRead CT summary report which is provided for each study. The report includes a main page as seen here, which shows all detect findings to include average and maximum diameter, lobular location, nodule type, and volume. Also included are image chip views of each finding in the current exam, along with any associated findings in a prior exam. In addition to the main page of the report, there are individual detail pages for each finding. The detail page as seen here will include an axial image of the centroid slice where the finding was detected, a magnified view of the finding with segmentation, as well as additional measurements to include minimum diameter and Z diameter. In this study, which we reviewed previously, there are 3 findings. The first one, shown here, is a small solid nodule in the right lower lobe with no associated prior finding. The second, a larger solid nodule also in the right lower lobe with no associated prior finding. And here, the last nodule detected is a part solid nodule found in both the current and prior exams. In this case, the detail page will include axial, centroid, and segmentation images of the nodule in both the current and prior study. When an instance of the same nodule is detected in both current and prior studies, the ClearRead Compare application provides additional measurements to include volume doubling time in days and volume change as a percentage, allowing for automatic measuring and tracking of nodule change over time. Also important to note that with a part solid nodule, ClearRead Detect will provide measurements not only for the nodule as a whole, but also for the part solid component as seen in this finding. All detect findings can then be migrated in a customized template to Nuance's PowerScribe reporting system. Here we have an example of a typical chest X-ray. Utilizing the ClearRead X-ray applications, bone suppression, and enhance, we are able to provide additional images for the radiologist's review aimed at increasing accuracy and efficiency. The ClearRead images can be stacked behind the original study to allow the radiologist to easily toggle back and forth between them, and since the ClearRead bone-suppressed image maintains the same tone and contrast as the original image, this can be done without refocusing. With the bone suppressed, the radiologist has an unobstructed view of the lung field, which increases the visibility of nodules like the ones we see here. In addition to bone suppression, ClearRead X-ray Enhance provides an automatically optimized image, eliminating the need for the radiologist to manually window and level each individual image, saving valuable time. In this example, we can see how even with a technically challenging portable chest X-ray, bone suppression can still perform. And maybe more importantly, ClearRead X-ray Enhance, by automatically optimizing the image, takes an otherwise diagnostically poor image and dramatically increases the usefulness without the need for the radiologist to manually window and level. In summary, the patented ClearRead software applications are designed to improve reading efficiency and accuracy pertaining to the detection of lung disease. As the first FDA-cleared concurrent reading device, ClearRead CT has proven, through our large-scale, multi-reader, multi-case study, to decrease reading time and increase nodule detection, with a vendor-neutral solution that is compatible with all PACS and modality manufacturers and approved for all nodule types. ClearRead X-ray, an FDA-approved vendor-neutral suite of applications, including bone suppression, is proven to help find 1 in 6 previously missed nodules, and with the Enhance application, shown to reduce reading time by 19%. Thank you for your time and interest in Riverain Technologies' Clear Read suite of applications.